open enrollment, we've talked about these different topics. But I was reading an article about the girl that was affected by that. And then the top article to the right of it was just simply, what is an HMO? And it had all these different comments and things like that where people, I guess because of open enrollment, are just trying to figure out what an HMO is.
Interesting.
Yeah, so what is an HMO?
Well, I'm actually curious why that would even be trending. It's kind of interesting. Now, because in different markets, though, there are different, like in South Carolina, there's really no HMOs to speak of. There aren't and there are. It's kind of talk about like what the history of it is, and other people who are maybe students of exactly everything. I'm just going to tell you what happened in the market. Okay, used to be that you could go anywhere you wanted to. All right, and that was just pure indemnity insurance back in the 70s and all that. And I don't even know the time frames exactly, but you go wherever you want. And so you had a health insurance plan. It wasn't anything like it is now, meaning in terms of cost. My old guy I knew when I first was a benefit broker, 20 plus years ago, or about 20 years ago at this point, was an old guy from James Island, South Carolina, named Dale Bostic. And Dale would say, nobody's going to pay $10 per month for health insurance. He said that's what they used to say.
Yeah.
He was old when I met him first. And he remembers delivering when premium was like $5 a month.
Yeah.
And that was just, if you went to the doctor, you paid, and then you'd be able to submit a claim and get your money back. Then they said, well, what we need to do is we're going to have these networks. We're not going to use everybody. We're going to have a preferred kind of network. And so you're going to have to go to these doctors, this set of doctors.
And that's a health maintenance?
I'm not there yet. That was a PPO.
That was a PPO.
That was a preferred provider organization. And then I guess it was maybe the 90s, was really what became the HMO market, the health maintenance organizations. And the whole thought was a lot of things. We're going to get away from as big as deductibles. We're going to implement copays. We're going to narrow down that network. And unless you are going to an emergency room, you're going to go to these people.
Yeah.
So you have higher volume inside that organization. And then health maintenance, we're going to work on that. There's preventative care that's covered. There's more stuff that's getting you used to going to the doctor that's designed to reduce cost. And what's really interesting is that some of the insurance carriers, which will go unnamed in various states, that they own both the PPO, and then they built separate companies to be the HMO. It was the same company. Right. Same pockets, like my left pocket, my right pocket.
Can't blame them.
Competing with one is genius.
Multiple brands. Who does that?
Yeah, who does that?
Right.
Who has how many? What was the ACA reporting?
Top 15 vendors in the country.
Right. So I can't remember who put out. Was it?
It's Shortlister.
Shortlister
released.
So Shortlister released the top 15 ACA reporting companies in the country, and yours company and mine too was 3 of the top 15, but nobody knows which 3.
Yeah, it depends on your logo.
Right. We were like, we're number 3. Great. Wait a minute.
Oh, wait.
We're also number. And we're also number.
And we're number.
Right.
I wish this would have gone to 25.
I'm pretty sure. Right. Yeah. Exactly. We got about 9 more in there.
See how many times we pop up. Yeah.
Exactly.
Yeah. That's that. Yeah. My question on the HMO is like, what are like the benefits or perks and the drawdowns? And because I'm just trying to get my hands around. So you have
I guess were they looking at it? Do you think like for open enrollment, like which ones to choose?
Exactly.
Okay.
I think that's why.
Yeah.
And so you have a primary care physician.
Sure.
Right. So it's just
you're gonna have to be referred.
It's a group of the primary care physician has to refer you to a specialist.
Yeah.
And it's a group of. So what is it? Your costs are essentially bartered and negotiated down because you're in network. They have the in-network providers, so therefore
there's
rates
going to be a network anyway.
Right,
but it's a much more tight network.
Well, that was what was confusing to me.
Sure,
not coming from that background of going, okay, what's the benefit? There's networks. How's this network different?
Right, it's a more narrow network. It's cheaper. That's why people are looking at it.
It's cheaper because to be in this network, you have they negotiate the providers down.
Well, that and they're really controlling utilization a lot. So in other words, you can't just go, my knee hurts, I want to get a doctor's appointment with an orthopedic.
Your knee hurts and you're going to go to the guy.
You're going to go to the primary care physician. He's going to go, you may need an Advil first. Let's try the Advil.
Right.
And come back, and they're really going to manage that care. Now, you'll see that some of that stuff, like out in other markets that I'm not as familiar with, like in California, you have Kaiser Permanente, which they are an HMO that own their own doctors and own the hospital. It's all one big baby. And so that's a different animal that I've never, they have it all.
Are these doctors incentivized to keep claims down for the carrier?
I think that they are to an extent, but it's not phrased that way. It would be to keep the patients healthier.
I know it wouldn't be phrased that way,
Sure.
but like I'm just wondering if that's.
I don't know if it's all doctors though they're pretty above board. Because I've always had those experiences. But the more, when I've ever got a chance to talk to a doctor, they're like, man, we ain't doing anything based on the insurance. We don't care. We're trying to get away from that crap.
Yeah.
We're just trying to deliver good medicine.
Yeah.
But that does make sense why people have been looking. Like my mom's on her Medicare supplement is an HMO out of Florida.
Okay.
To where she can only, she can't go to doctors up here in South Carolina. She has to go in Florida unless it's emergency.
It makes sense.
Yeah.
That makes sense. And then there's this. I wonder, what are the plans that are on the exchanges? Are there?
I don't know if they're HMOs or not. There's most of them. What my experience would be, they're probably PPOs, the vast majority, meaning an in-network and out-of-network benefits. Right. Like you can. Here's a set of providers. You don't have to go to these people though. Like my doctor, that she's not in network. She's like a concierge doc, and at least I don't think she is.
Oh no, my bank account has proof that she was not. I looked into it for sure. She was out of network.
She's out of network.
So you had to pay the full cost, but she's worth it.
She's very worth it.
Oh, it's always what he was doing. Oh, Mark, your cholesterol.
Oh, this looks terrible. What are you going to do about it?
We must do this heart test.
What are you going to do about it?